Assalamu alaikum.
Walaikum Assalam.
So the last session we started with conjunctivitis. We had a brief overview of the differentials of red eye. We discussed the differentials of red eye, and then we discussed the important symptoms and signs of conjunctivitis and how we can broadly classify conjunctivitis into viral, bacterial, or allergic conjunctivitis. So today we will start with bacterial conjunctivitis. There are three important sets of cases that we will discuss. This will cover all of the important things which you have to know about the different types of bacterial conjunctivitis. All right, so let's start with it. Now, first set. Our first set, I'm not going to write the typical history or anything else. You know that in all the patients of bacterial conjunctivitis, they present with redness in the eye, they present with pain, they present with discharge, which is either purulent or mucopurulent, etc. So you have three patients who have that typical bacterial conjunctivitis history, that typical history which I just told you. We will discuss these three cases one by one. Now, first, I want to look at these three pictures. All right, look at the first one, and let's write down the important findings in this examination. So in this examination, we have redness or congestion of the conjunctiva, which is diffuse, right? Second, we have a discharge. These are the two things which we can readily observe in this examination. So, moving on to the next examination. What do you see in this picture? What are the important signs? So we can see that the outer canthus of the eye is visible to us. This is the outer canthus. The inner canthus has the lacrimal area. All right. So the outer canthus is visible to us. Discharge isn't visible at all. However, there is conjunctival redness. Conjunctival what do we call it? Perfusion or edema of sorts, hyperemia. That's the term. So there is conjunctival redness, which you will, if you notice properly, it is located around this specific area. The upper part of the conjunctiva is free from this hyperemia of this redness. So number one, we have redness of the conjunctiva. Which area is this called? If anyone has an idea. The area which exactly aligns with the closure of the lids, जहाँ पे आँखों की पलकें बंद होती हैं. This redness is confined to that area. Okay. This area is called the intermarginal strip. That is our first finding in this picture. Now, the second finding is at the outer canthus. What do you think is wrong at this area? कोई तो बताए.
Discharge है कोई?
Discharge, ठीक है. There is either redness or yellowness at this outer canthus. Right? We cannot appreciate frank fluid as such as we saw in this case. Or in this case, this is actually maceration. Maceration of skin. This means that there is maceration. आपने पढ़ी है ना forensic में? It's the more or less the same thing over here. Okay? It's maceration of the skin at the outer canthus. These were our findings in our second case. Now, moving on to our third case. You've seen this picture before. What is the most peculiar or the surrounding striking finding in this picture?
Membrane.
Is a membrane, right? Now, if I were to say that this membrane is easily peeled off, then it would be a
Pseudomembrane.
membrane, right? It would be a pseudomembrane. Now, we discussed pseudomembrane in one case, which we will discuss again later on. Now, so we have our three cases of a typical picture or clinical presentation of a bacterial conjunctivitis, in which there is discharge, there is redness of the conjunctiva, and along with those things, we have, in this case, case number one, diffuse redness and congestion. In case number two, redness at the intermarginal strip and maceration of the skin at the outer canthus. And then our case number three, pseudomembrane. Now, how will we investigate or further work up this patient?
Slit lamp.
Slit lamp. This is a slit lamp examination. We've done the examination. Okay, we've done the examination. Any other investigation or workup after the examination you would like? These images are from a slit lamp examination. क्या investigations कर सकते हैं हम in a patient who has bacterial conjunctivitis? We've done all the necessary examinations, right? Think from a microbiology point of view.
Scrapings या discharge की microscopy.
Exactly. Okay. Someone's also said blood CP. Blood CP is a good examination. It will tell you about the nature of the infection. So if it's a bacterial infection, it's a bacterial conjunctivitis, what do you expect to be elevated in the blood CP? Neutrophils, right? So neutrals are elevated. Secondly, scrapings and discharge. What can you do with them? Scrapings, there are two things which you can do. One is culture and the other is immediate microscopic examination, right? These are the two important investigations which we need to do. Now, the scrapings are more important as compared to neutrophils, because we know that in order to differentiate between the three types of conjunctivitis we've already discussed, we can generally differentiate them between them based on the type of the discharge. So in all these three cases, we have a mucopurulent or a purulent discharge, which means that in all the three cases, we have a bacterial conjunctivitis. Now, the important thing with these three cases is we have to find out which organism is causing this specific type of conjunctivitis, and that we can do based on some specific signs which I've told you. Now, in our first case of our typical bacterial conjunctivitis, the patient has redness, congestion, which is diffuse, and he has a discharge. Now, if he were to give you a history that his discharge is copious, we can already see that his conjunctiva is red, is diffusely red. Which organisms should come to your mind in this case? Random guesses. कुछ भी बोल दो. Anyone?
Staph aureus.
Staph aureus. Or
Streptococcus.
streptococci. That's good. Streptococci. Or
Moraxella.
Moraxella. Moraxella is a very important organism. So if we draw the list, we can list almost all of the microorganisms which can cause bacterial conjunctivitis, right? So how do we differentiate between these organisms? How do we know that this is Staph aureus? How do we know that this is Moraxella? How do we know Streptococcus? Obviously, we can define that out of the culture. वो हमें पता लग जाएगा. but the important things in terms of clinical signs and clinical symptoms. So I'm going to give you a clue over here, right? First clue was that this redness, this congestion, it's diffuse, the discharge is copious. The third clue in this case is that this patient, he had urethritis a few days back. Why is this clue important? Which organisms, microorganisms, they cause urethritis?
E. coli.
E. coli, that's good. Or if it's a female patient, cervicitis. Urethritis or cervicitis? Urethritis is in males and cervicitis in females. What are these basically? What are these? These are now urethritis is a UTI. Cervicitis is a genital tract infection. So urethritis and cervicitis, they can be both termed under the heading genital tract infections or sexually transmitted infections. Which organisms can cause STIs or STDs?
Chlamydia.
Chlamydia. Now, that is a very important organism. And the second organism,
Neisseria gonorrhea.
Neisseria.
Neisseria gonorrhea, right? So you have, on the basis of these clues, yes, that he had the patient, if he was a male, he'd have urethritis, and if he were a female, he'd had cervicitis. You have two microorganisms in your differential. One is Neisseria gonorrhea, I'm going to term it N, and the second is chlamydia, which I'm going to abbreviate SE. So these are the two important differentials which you have to keep in mind. Now, this patient who had a typical bacterial conjunctivitis history, who had redness, congestion, which was diffuse, he had discharge, which was copious, and he presented with a urethritis or a cervicitis. In short, an STD or an STI. This patient has Neisseria gonorrhea conjunctivitis. Now, this is important. आपने याद रखना है कि why this patient is Neisseria gonorrhea and what the typical history is. Redness, congestion, which is diffuse, discharge, which is copious. Now, discharge, which is copious, and the redness and a congestion, which is diffuse all around the eye. This type of conjunctivitis, it's called, if anyone knows, it's called a blenorrhea. Okay? So, our first case is an acute blenorrhea or an acute severe bacterial conjunctivitis presenting with a coinciding STI, STD, urethritis in males, a cervicitis in females, and the most likely organism is Neisseria gonorrhea. Now, we know that there is another organism which causes STIs, that is chlamydia. We will discuss chlamydia conjunctivitis later on in the same session, but this is Neisseria gonorrhea conjunctivitis. Moving on to our second case. The important things in this case are redness and conjunctival irritation, discharge, etc. All the signs, they are located at the intermarginal strip. And secondly, there is a maceration of skin at the outer canthus. So you can see that based on the signs, it is only affecting the middle portion of the eye. If I were to draw a straight line, this would be the intermarginal strip. Okay. This would be the intermarginal strip with both the eyelids they close. So in our second case, the inflammation, the signs and the symptoms, they are located around this area in the conjunctiva, and secondly, over the outer canthus, skin of the outer canthus. This is a very typical history. This is a very typical examination. And this should lead you towards the diagnosis of diplobacillary conjunctivitis, also called angular conjunctivitis. You have to remember this. Angular conjunctivitis caused by, does anyone know the organism which causes angular conjunctivitis? It's the Moraxella. Someone said Moraxella. This is caused by Moraxella. Moraxella lacunata. So our second case of a typical bacterial conjunctivitis in which the patient presents with symptoms of redness in his eye, presented with symptoms of discharge, and all those other conjunctival symptoms of foreign body, etc., etc. On examination, there was redness at the intermarginal strip and maceration of the skin at the outer canthus, which is in continuity with the intermarginal strip. This is your typical case presentation of angular conjunctivitis caused by Moraxella lacunata. This is important. You have to remember this. And thirdly, ये आपको पता होना चाहिए. In our patient who presented with redness, etc., all those symptoms of bacterial conjunctivitis, we find a pseudomembrane. What should be your diagnosis or the organism which you should suspect in this case? Discussed this the last time around, right? This is a pseudomembranous conjunctivitis.
Diphtheria.
Diphtheria.
Right.
Conjunctivitis. Do you think any other organism can cause pseudomembranous conjunctivitis? Someone, अभी 3 organisms की बात हुई थी पीछे. One was Staph aureus, the second was Moraxella, the third one was
Streptococci.
Streptococci. Strep pneumonia, also called pneumococcus. Pneumococcus is a second organism which you will find in case minutes in prof examinations, which or even in vivas, which will be related to pseudomembranous conjunctivitis. So we have 3 diagnoses over here, right? Our first one was blenorrhea, acute blenorrhea caused by Neisseria gonorrhea. This was our first case, our first diagnosis. The second was angular conjunctivitis caused by Moraxella lacunata. The third one is pseudomembranous conjunctivitis caused by either diphtheria or either pneumococcus. Now, how will we differentiate whether it's diphtheria or pneumococcus? Based on clinical features, based on the history and the examination. Obviously, when you are investigating this patient, you will perform conjunctival scrapings. This membrane will be looked on under microscope under different strains, and you will also perform cultures. उससे आपको diagnosis मिल जाएगा. But based on the clinical symptoms, diphtheria and pneumococcus, I'm going to give you a hint over here. One of these has a vaccine. Which one of these has a vaccine?
Diphtheria.
He has a vaccine. Eh? What is the name of that vaccine?
DTaP.
DTaP. Yes, diphtheria produces. बिल्कुल ठीक है. We use the DPT or it's a DTPM, मुझे भूल गया. DPT vaccine. Diphtheria, pertussis, and tetanus. Right. So the main concept over here is that diphtheria has a vaccine. Now, you know that diphtheria, it's part of the DPT vaccine or the DTaP vaccine. It's a part of the API schedule, is it not?
Yes.
बिल्कुल है ना part उसका. So what do you think will be the context clue in the case unit or in the clinical history of a patient who presents to you with diphtheria pseudomembranous conjunctivitis? What do you think will be the important clue over here?
Unvaccinated.
Unvaccinated. That is correct. Unvaccinated. Okay? that is the first important clue that the patient will be unvaccinated. Now, diphtheria किस उम्र में ज्यादा होता है?
बच्चों में
बच्चों में ज्यादा होता है, right? So there's a demographic clue that the patient will be a child. Now, these are the two important clinical features on the basis of which you will differentiate between a pseudomembranous conjunctivitis caused by diphtheria and that caused by pneumococcus. Okay? This is how we will know that a patient who will have diphtherious pseudomembranous conjunctivitis, he will be unvaccinated. Classical demographic will be a child. And secondly, what is the मतलब क्लासिकल और जो हम एसोसिएट करते हैं डिप्थीरिया के साथ जो इन्फेक्शन है या जो डिजीज है, व्हाट इज दैट डिजीज? हमें पता है कि स्ट्रेप निमोनिया का नाम है, इट कॉजेज निमोनिया, टीबी कॉजेज टीबी, सो डिप्थीरिया व्हाट डज इट कॉज? डिप्थीरिया इज व्हाट, जो हम डिप्थीरिया आम जुबान में कहते हैं कि इस बच्चे को डिप्थीरिया है, व्हाट इज इट बेसिकली? Pharyngitis. ठीक है? In diphtheria, in classical diphtheria, there is a pharyngitis, a pseudomembranous pharyngitis, जिसमें गले में पीछे pseudomembrane बनता है. So these are the important context clues in the case minute which you will get. Now I'm going to revise all of the three once again. In our case of acute blenorrhea, there will be a patient who will have the typical symptoms along with redness, diffuse congestion. His discharge will be copious. This is very important. You have to remember this. Copious discharge. Copious discharge in the terms that आंखें साफ कहता है फिर दोबारा discharge आ जाता है. And the second, this is second most important. The most important diagnostic point is that there will be a coincident urethritis or cervicitis, meaning that there will be an STI or an STD. Or if there's not an STD or an STI, if it's not diagnosed, then there will be a context clue given that the patient is sexually active. What will your diagnosis be? It will be acute blenorrhea caused by Neisseria gonorrhea. Our second case of a patient presenting with typical symptoms of bacterial conjunctivitis. His redness and his hyperemia, it's confined to the intermarginal strip, and he also has maceration of the skin at the outer margin. This is your case of angular conjunctivitis caused by Moraxella lacunata. These are the important terms. Intermarginal strip, maceration of the outer canthus or even inner canthus. So the first thing which should come to your mind is angular conjunctivitis. Okay, this is very important. This is almost, मतलब इसके अलावा किसी और disease पे ये चीज बात fit नहीं होती. No other disease causes this specific maceration, this specific redness or disease. Now, a third case of a patient presenting with the typical symptoms of bacterial conjunctivitis. There's a pseudomembranous formation. Now, if our patient is a young, unvaccinated child who has also coincident pharyngitis, then our diagnosis is diphtheria. Or if our patient is an adult and he has no other disease or no other abnormality, then our diagnosis is pneumococcal pseudomembranous conjunctivitis. These are the three important differentials which you have to remember when you're discussing a typical case of bacterial conjunctivitis. Yes, the list goes on and on. And any disease, virtually any bacteria can cause conjunctivitis, from Staph aureus to all of this. But there are some important clinical features, some coinciding features, and some context clues in the history which are important. Blenorrhea, it's urethritis and it's cervicitis. In angular conjunctivitis, it's the intermarginal strip and the maceration. For pseudomembranous conjunctivitis, if it's diphtherial, we have an unvaccinated child. If it's pneumococcal, then our demographic is different, right? So these are your three cases of a typical bacterial conjunctivitis. What will be their treatment? We will discuss it later in this session, right? Now, moving on to our next three group of cases. Scale of follicles. All of our three cases discussed below, they have follicles. Now moving on, starting with our first case. Look at this patient. These are the follicles which I showed you in the last examination, right? So this is our patient, and there's no history of a typical conjunctivitis, right, at this moment. Now, in this case, in this patient, what are your findings? What do you see? Is there any discharge? Can you present? Is it mucopurulent or is it purulent, the discharge? It's neither. The discharge isn't mucopurulent or purulent, so it's most probably a mucoid discharge. And in the second picture, the important thing is that there are follicles. Now the follicles, where are they located? Which is this area? And this is the lower tarsal conjunctiva or the lower palpebral conjunctiva. Lower follicles in the lower palpebral conjunctiva. Okay, this is the lower palpebrum. This is the lower lid, and the conjunctiva adherent to the lower lid, it's called the lower palpebral conjunctiva or the lower tarsal conjunctiva, right? So these are our findings in this first picture. Now moving on, in this second picture, which conjunctiva are we examining in this picture?
Upper palpebral.
It's the upper palpebral conjunctiva, right? And the same in this case. So in the first picture, what can we appreciate? There are conjunctival vessels, right? But there are some spots over here, some areas or some large dots which do not have redness or which do not have the vessels. These are follicles. In our first picture, our first important finding in this is follicles. Where are these follicles located? Upper palpebral conjunctiva. In the second picture, what do you see? Or what do you think is different from this upper picture?
It's pale.
It's pale. Excellent. One more thing.
The blood vessels are not.
Blood vessels are not present, right? You cannot see those blood vessels which you were seeing over here. It's pale. The blood vessels are absent. And secondly, they are these whitish bands. Yeah, whitish bands are running across the upper tarsal or the palpebral conjunctiva. So in the second picture, we have obscure, we cannot see, obscure tarsal vessels. And secondly, we have scarring or bands of fibrous tissue. All right. Now these were our findings in this case. Now in the third case, we have mucopurulent discharge and we have follicles. Where are these follicles located?
Lower palpebral.
Lower palpebral conjunctiva. Yes, these are lower palpebral conjunctival follicles, right? So I will just copy this. The discharge in this case is purulent or mucopurulent. I will write only purulent, but it can be either mucopurulent or it can be purulent. So here we have our three cases in which there are follicles. These are the only three cases which you will be given in which history or the Vignette table will be follicles. Okay. Now, the first case, what do you think our diagnosis is? Viral conjunctivitis. So our first patient is of viral conjunctivitis. Viral conjunctivitis we will study later on in our further sessions. So why is this viral conjunctivitis? Because the discharge is mucoid, and secondly, there are lower palpebral follicles in the lower palpebral conjunctiva. So we have two important signs of viral conjunctivitis. Our second case, follicles in the upper palpebral conjunctiva, obscure tarsal vessels, scarring, and fibrous tissue. What do you think the diagnosis is in this case?
Trachoma.
Trachoma. Our second case, very important, is of trachoma. Trachoma is caused by Chlamydia trachomatis serotypes. Chlamydia trachomatis, CT, serotypes A, B, and C. You have to remember this, it is very important. मैंने आपको पिछली बार ही बताया था, I'm going to reiterate this now. Why? Because of our third diagnosis, which is very important. Now, the discharge in this case, it is purulent, so, which means that there's a bacterial etiology. Now, there's a bacterial etiology, but we also have follicles. We have follicles in the lower palpebral conjunctiva with purulent or mucopurulent discharge. What do you think is the organism here? Chalo, a context clue, a history. This patient has a history of STI. What is your diagnosis?
Neisseria.
Neisseria gonorrhea, right? Neisseria gonorrhea. ठीक है. History of STI1 is Neisseria gonorrhea. Is another organism specifically
Chlamydia.
Chlamydia trachomatis. Chlamydia trachomatis with serotypes. T through K, right? So this is our diagnosis of Chlamydia trachomatis. Once again, giving you a brief overview. Whenever you have a clinical vignette or a case in which a patient has follicles, the important thing or the important context clues is number one, what type of discharge there is. Whether the discharge is mucoid or is it purulent or mucopurulent. In the case of viral conjunctivitis, only the discharge is mucoid, right? In the rest of, in the other two, both caused by chlamydia, the discharge will be purulent or it will be mucopurulent. So one thing in the context of follicles, what type of discharge is it? And the second thing, which is very, very important, the location of the follicles. In our first case of viral conjunctivitis, what is the location of the follicles? It's lower palpebral conjunctiva. In our case of trachoma, what is the location of the follicles? It is the upper palpebral conjunctiva. And thirdly, what is the location of the follicles in chlamydia, serotypes T through K? It's in the lower palpebral conjunctiva. Right? So these are important concepts.